in my introduction, you heard that I have been a caregiver going on 7 years now, and a full-time caregiver. And I'm really mindful of the voluntary sector for a number of different reasons. So the first is in the province that I live in, which is Ontario. 80% of all care that is given to seniors in the community is given by caregivers. And 30%, and I would venture to say that, like Vicky said, and what's changing in her community, the most recent data I have is that 30% of services in institutions are provided by informal caregivers. And I would say that with everything that we've been seeing in the medical system recently, I'm sure that that number has gone way up. So, but and frankly, it would cost at least $26 billion annually to replace the work of Canadian caregivers in caring for seniors. But as I was listening to this, and I was listening to what Michelle's the data about the change in numbers on volunteers, I thought of myself as a caregiver for the last 6 years, but I really hadn't thought of myself as a volunteer in such a strong way. So you're sort of I'm reframing as we go. So a few things. So interestingly, I've been working with the healthcare system for the last 6 years, and I had never actually heard the term third sector before. So it's very interesting to hear it and to hear how it's being used. And, it's interesting in reflection on some of this. One of the things that I realized is that if you need a service and someone tells you about a service, you actually don't know if it's a voluntary service or a paid service necessarily. If it's something that comes through the medical system, and then you don't know sort of where else it comes from. But as an example of, and I'm going to talk a bit more about things that we don't know. So the fact that this knowledge sharing is going on is so incredible. But my mother-in-law was a post-polio survivor, and it was actually the March of Dimes who installed at no cost a staircase, electronic staircase into her home, and made me realize sort of more about what some of those voluntary organizations do. Because as you've all been speaking, everybody is acknowledging that healthcare. I mean, and when I think it was Richard who talked about that the amount of healthcare that's actually formal is such a tiny bit of it. But when you're a caregiver and you're trying to coordinate this, it's social, it's emotional, it's physical, and you're trying to understand where all of these things work. And again, in Richard's presentation, there was something about, it's not that we don't have the services, but it's that we don't know about them, or we don't know how to access them. So one of the things that I have been thinking about a lot in my caregiver journey is, wouldn't it be great to have a concierge or a personal assistant for caregiving? And so I throw this out here. I know we have a very complex system. I know that it's very hard for people to sort of integrate care, but one of the things, as someone who is both a volunteer and a caregiver, is you don't know what you don't know. You don't know what may or may not be out there, and you can be too overwhelmed to even access it when you do know. And I have long thought that perhaps there is a job match that can be created at some point of that kind of concierge for integrated care, so that there's somebody who's on this journey with you who can help. So I ask you all just to think about that, whether there's a possibility. But, I will say that to Vicky's point about the fact that they have these unmet needs that they just can't get at, it's actually this won't surprise anybody, it is terrifying to be a caregiver of someone whose health will eventually deteriorate in a health system where you know that there are not a lot of options. So the idea that people are talking about this and looking at integration and looking at this loneliness issue is absolutely tremendous. One of the things that's interesting, and I noticed someone on the an attendee is on this. My building has just been declared a NORC, or a naturally occurring retirement community, and one of the things that we're struggling with, and so I did see some of these comments related to the drivers, was we want to be able to do wellness checks on people, but not social wellness checks. So we want to be able to figure out some kind of system to just make sure that people are waking up every morning. We have other provisions to put in social activities. But so I'm going to ask this of the audience, that if you know of any digital or technology-based system that can contact people and do an interconnection, just to make sure that people are okay, I would so appreciate hearing about it, because there are two things. So when you talked about the drive, people are risk averse to being responsible for following up with an individual to make sure that they are okay when it's a neighbor. And the other is, and this is the challenge, is that with all of the loneliness and the isolated people, that you want to know what you're getting into. And if you're getting into a phone call, you need to know that that's a fairly substantial commitment. And so looking at where technology can help would be very helpful. So the other thing was the drawing that Michelle had of the evidence of the expectation of health impact and the reality of health impact, with the straight line versus the completely twisted line. And I will say that A, that is absolutely true, and B, that that is often what people who are in the midst of this crisis feel is happening to their brain, when there is so much that is confusing and hard to deal with, and you're just looking for someone who can sort of give you some help to figure out how to connect the dots. And so the fact that there are so many people working in this integrated healthcare and connecting the dots is absolutely amazing to me. So the only other thing that I'd like to say is that as part of the knowledge sharing, and I love that front door. If there was some way of getting a tips book, and yes, the entry level could be the family doctor, it could be the hospital you're in, it could be, but that just shares that knowledge of what might be available, I think it would be used so incredibly. And when I think about that, I think that, when you think about the volunteer sector, it's not just the agencies, but it's the things like the parks. It's where we go for our exercise. I think I'm getting the signal. So I'm going to wrap it up, except to say, I hope this was of some value, but I got so much out of this and the chat, and hope to get more. So thank you all very much.